Welcome to the Compression Shock National AED and CPR training. My name is Gabriella Shatman. I am a nurse in the pediatric ICU here in Roanoke at Carilion. We're just going to go through a quick presentation on the importance of CPR, and then we will move on to the hands-on portion. So, a lot of times people feel very distanced from the idea of doing CPR, thinking it doesn't affect them, it would never happen to them. But I can tell you it happens, cardiac arrest happens to kids, adults, elderly people. I personally know children, adults, elderly people that had no prior cardiac history and suffered a cardiac arrest. So it's really important to have this education, learn, and teach as many other people about this. So we'll have, this is a video of a cardiac arrest survivor named Joel.
Good afternoon, my name is Joel Byoff and I'm a certified registered nurse and anesthetist with the Carilion Health System. In this very room about a year and a half ago, and it was actually February 4th of 2019, I was doing all the right things, trying to stay as physically fit as I could, working out every morning, exercising before work at about 10 to 6 in the morning, and on a treadmill that's right over there, I had a sudden cardiac arrest and went down on the ground. One of my colleagues happened to have been working out next to me and immediately got on my chest, called a code procedure, and within minutes the emergency department came down and continued with advanced life support. This happened on Monday, and on Thursday they woke me up with no brain damage, and I am here now a year and a half later, still giving anesthesia with no residual problems at all because someone got on my chest right away.
Hi, my name is Ethan Byoff. I am this guy's son. As he said, it was February 4th. It was a pretty brisk and cold day, and I was taking our dog back from a morning walk when I am told that when one of my mom's friends comes in, she says that he had passed out. Now, I don't exactly know how. I didn't even know why it had happened. I was just told he had passed out, so we immediately go to the hospital, and I figure, okay, if he just passed out, we'll check on him and I'll go back to school. I didn't realize that his heart had stopped, and it was one of the scariest, most hopeless feelings I have ever had, because I really love him and family is really close and important to me. Every time I think back to that day, I can't describe how thankful I am that someone was in here and able to immediately start CPR and get him back until the immediate attention could be given to him, professional attention, and it's indescribable. It's just a wonderful feeling, and words can't describe how thankful I am.
I cannot stress the importance of the ability of lay people to be able to get on the chest when someone goes down in public, or especially outside of a hospital setting, because I was extremely fortunate that I actually had my cardiac arrest in a hospital. But for everyone out there that has cardiac issues, cardiac arrest, and problems outside of the hospital setting, the Compression Shock Foundation is trying to teach people to get on the chest and start compressions as soon as possible. More and more lives can be saved, more and more brains can be saved, and there will be more success stories such as myself. Thank you for listening, and I just thank God that I'm here to be able to tell you about it today.
So we'll talk about COVID. Obviously CPR is something where you're in pretty close proximity to somebody. There may be like secretions from people's mouths that kind of fly up, all the things we're told to avoid right now. But the American Heart Association really stresses that we should still continue to give CPR, and we'll learn later that we don't suggest that you do the mouth-to-mouth portion anymore, so that's one change. Another thing you could think about is putting a face covering, like you guys are all wearing, over somebody's mouth should you be in the situation where you are doing CPR. And I guess the other thing is a lot of cardiac arrests and a lot of the ones that you may come across or witness are going to happen in the home or with a group of people that you're close friends with. So people that are kind of already in your circle, you probably already have been exposed to them, if that's what you want to call it. So something to think about, people in your family, people in your home. Again, COVID and cardiac arrest, the incidence of cardiac arrest has actually gone up during this period. Research from the American College of Cardiology says that there have been more out-of-hospital cardiac arrests since March, when the pandemic sort of started in the US. Because of that, EMS response times have increased, so it's taking EMS crews longer to get to these victims. Bystander CPR rates have gone down. Survival to hospital discharge has then also gone down, and like we said, the incidence of out-of-hospital cardiac arrest has gone up. So all kind of linked and related. So today, I kind of told you we're going to learn about what cardiac arrest is, learn how to identify it in children and adults, learn when to perform CPR and when to use an AED. We're also going to go over choking and try to have some fun. So we've broken it down to make it really, really simple for anybody to understand. We have a 3 C's algorithm or motto. So the first one is check. If you see someone collapse, you want to check and see if they're breathing normally. If it's anything other than normal, that's a sign that you need to start CPR, that they could be at risk for having a cardiac arrest or just be in extreme distress. So your next step after you check the person out is to call 911. I always tell people, if you're outside and it's just you by yourself, call 911 and put it on speakerphone and literally put it down next to you. You don't have to have it up here, like don't stress about that. Have your hands free. And then the last C is compress and look for an AED. You're going to try to move the person to a hard surface. So like if you find somebody in a bed, try to drag them down to the floor. You're going to press hard and fast in the center of the chest at a rate of about 100 beats per minute. And if an AED is available, you do want to get that hooked up and running and hooked up to the person as soon as you can. So this graphic shows that if somebody suffers an out-of-hospital cardiac arrest and there's no bystander CPR, they have about a 10% chance of survival. So that's just waiting for EMS to get to the scene. With bystander CPR, your chances go up to 30% survival, which is a whole lot more than 10%. So if you witness a collapse, do CPR, that person's survival rate goes way up. That way, because you're getting on the chest early, you're not waiting for EMS to arrive. So just to put it kind of in numbers, because I think that's helpful, there are about 350 sudden cardiac arrests outside the hospital in the US per year. And if every one of those people received bystander CPR, you could save 70,000 lives. Just some physiology of cardiac arrest. It is when the heart stops pumping blood through the body, you then lose a pulse. The person will collapse if they're standing or sitting, they'll collapse. You may see some weird breathing, snoring, grunting, just something that doesn't look like normal in and out respirations. And you may also see seizure-like activity. One thing that people often get confused and are sometimes embarrassed about is the difference between heart attack and cardiac arrest. We hear so much about heart attacks, and especially like in the older population, but a heart attack is caused by a blockage in the blood supply to the heart muscle. A person that's having a heart attack is conscious. They may be in like extreme pain, all the things you kind of hear about, crushing chest pain, but they're conscious, they have a pulse, and they're breathing normally. It may be really fast, but they're breathing. So just a little graphic, a cardiac arrest, someone that is having a cardiac arrest is unconscious and has no pulse. They have abnormal breathing or are not breathing at all. And someone having a heart attack is conscious, usually breathing or talking, screaming that they're hurting, something of that nature. Again, unconscious and not breathing normally are signs of cardiac arrest, and that means you should be ready to do CPR. So kids, we're going to talk a little bit about pediatric population. A school-age child, anywhere from, say, 5 to 18, we say, as an adult, there's no difference. So we'll go over the CPR. It's the same for all those kids. Even as young as toddlers, I would say, is the same. Infants are a little bit more difficult because they're so different from us. Just body shape, the way they breathe, they're always sleeping. Like, it's a little more difficult to decipher kind of what's going on with them. But if they're unconscious, if you cannot wake them up at all, if they're not breathing normally, again, and if they're blue or floppy, babies have reflexes. Even if they're sleeping, you should be able to pick up their arms and they'll get scared, they'll tense up. If your baby is floppy, that is your biggest indication that something could be wrong. CPR stands for cardiopulmonary resuscitation. It's a way of manually pumping blood through a victim's venous system during cardiac arrest when the heart stops doing that job. So we'll talk about some barriers to CPR, why people may not want to do it. People worry about all kinds of diseases. Obviously, we talked about COVID, things that are even, a little bit maybe longer lasting or scarier, HIV, AIDS, hepatitis. So the CPR that we're going to teach you today and that we recommend has no mouth to mouth. So you can't catch any of those by just touching a person. Lawsuits, people worry like, what if I'm doing this wrong? What if I'm not exactly sure? You're protected under a set of laws called the Good Samaritan laws, and there have been no successful lawsuits against a person who has done bystander CPR. Bystanders of out-of-hospital cardiac arrests are more likely to face legal consequences for delaying or failing to provide CPR than damages incurred during a resuscitation attempt. We talk about people get worried that they're going to hurt a person. We always say something like a broken rib or bruises are much better than dying from a cardiac arrest. So those will heal. This is a video of a 6th grader who is performing CPR, so really anybody can do this.
Me and Bailey are gonna show you what CPR is.
The 6th grade classes at Orchard Elementary were a little different today.
And push down 1, 2, 3.
11-year-old Skylar Berry is adamant everyone should know CPR. She's teaching her classmates the very easy method of hands-only CPR.
1, 2, 3.
Doing just compressions to the beat of...
Stay alive, stay alive.
She and her friends have even started a CPR club, cleverly called Staying Alive.
It can happen any second or any time. They could be choking on food to drowning in a pool.
But why is an 11-year-old so laser focused on CPR?
Thank you. This is the fire department. What is the address of the emergency?
He's not breathing.
Because at a birthday party on Sunday,
He was gone, like right in front of all of our eyes. We lost a friend.
the kids were playing in this pool in Antelope when they realized
As he got deeper, we noticed, and my friend Manuel was like, he's not playing around, I know my friend. I checked his pulse and I was like, there's no pulse. So I started the CPR.
I thought he wasn't going to make it. I thought there was going to be a death.
David Baltzley was the birthday boy.
It was pretty cool. I mean, I've never seen an 11-year-old do CPR on another kid. It was just so relieving.
Relieving because
Is he okay? They want to know, is he breathing? Okay, he's awake.
he is one of their friends and is a little overwhelmed by the attention, but he was back in school on Monday and is just fine.
I just started crying. I was so proud. I couldn't believe it.
Marissa is Skylar's mom.
And I asked her, I said, how did you know that? And she says, Mom, fire camp, duh.
Fire Camp is a summer camp put on by Metro Fire teaching kids fire safety, CPR, and more. Skylar is the one in the blue shorts. She learned CPR right before school started.
You cross it and go down.
And now she'll spend whatever free time she has this school year teaching others to save lives.
Real life situations are serious. It's not time to mess around.
All right, so we're gonna go over the mechanics and how to do CPR now. We already talked about the 3 C's, check, call, compress. Just try to remember that order. So, doing CPR, you're gonna put one hand on top of the chest, kind of at the breastbone, right in between the nipples. The other hand goes on top. You're gonna lock your elbows and press down hard and fast on the chest about 100 times per minute, which is the beat of staying alive. Not the slow part, the fast part in the middle. You wanna make sure you're compressing the chest about 2 inches. I know that seems like a really arbitrary kind of distance or something that's difficult to measure. You're gonna wanna press hard on the chest, even if it's a little person. Again, like I said, 2 inches, this graphic is pretty good. It just kind of demonstrates how deep you need to go, making sure that you come all the way back up after you do compress, letting the heart recoil and totally fill back up with blood. Timing is crucial, so every minute that passes without doing CPR, a victim's chance of survival decreases by 10%. So this is the time between when you stop CPR and when you defibrillate with an AED. Worst case scenario, like I said, you should have already called 911. Have your phone on speakerphone if you're totally alone, and the dispatchers will walk you through, because even in a situation like this, high adrenaline, you may kind of forget parts of it and have to be reminded, and the people on the end of the 911 call will be more than happy to talk you through anything that you've forgotten or that you're nervous about. Child CPR. You're gonna compress about 1/3 the depth of the chest. Infant CPR is the same way. But we're gonna talk about the difference in infants. Instead of using one hand, you'll be using 2 thumbs or 2 fingers to compress the chest, just because they are so little. Rescue breaths. So I know we talked about we're not doing mouth to mouth, but with infants and children, most cardiac arrests are the result of a respiratory arrest. Child stops breathing, has some kind of upper airway obstruction, they swallow a Lego, they fall into the pool. It's all a result of them not breathing, so then their heart stops. So again, only if you're comfortable, but likely if you're giving CPR to a child, it's someone in your family or someone that you're babysitting, someone that you've been around and you're probably pretty close to them. So rescue breaths, the ratio is 30 compressions and then 2 breaths. You'll breathe in over their nose and their mouth, just enough to make the chest rise. This will help with the sort of respiratory component of the arrest. So then the AED. AED stands for Automated External Defibrillator. They're all over. They're in libraries, they're in churches and malls, schools, airports, and even a lot of police cars have them. So AEDs seem a little bit intimidating, but they're very, very simple. You open up the AED and it tells you exactly what to do. And if you're too slow, it'll tell you again. Again, you turn the power on and it'll tell you, it analyzes the heart rhythm and it'll tell you whether the person needs a shock or doesn't need a shock, depending on the nature of the cardiac arrest. You won't hurt yourself or others. It's not going to shock you. If you're touching the person, it's going to also analyze your heart rhythm, so it's not going to advise a shock. Not great for the person that's in cardiac arrest, but it won't shock you. Most AEDs come with 2 sets of pads, a standard adult set of pads, and then a pediatric set. If you have the time and you are comfortable, obviously pediatric pads are best for a pediatric patient, but you can just use the adult pads, one on the front and one on the back, just making sure that they're not touching. Couple of scenarios you might encounter. This man has a pacemaker, totally fine to still use an AED because obviously the pacemaker isn't working, or if there's not an implanted defibrillator in that pacemaker, then it's not going to restart the heart. But make sure you place the pad next to it, just not right on top. This guy has a hairy chest. You kind of have 2 options. There's usually a razor in the kit, or my preferred option is you stick a pad down, you rip it off, and you get a new set of pads, and you put the fresh pad on the bare skin. The last one is a medication patch. You can take it off if you would like, but a better option is to just put the pad next to it. If a shock does go through that medication patch, it can burn the skin a little bit. So now we're going to talk about choking a little bit, because that's something that we see often in pediatrics, in kids. So if the child is still talking or coughing or crying, then you don't need to do anything. Encourage them to try to keep coughing it up, because a lot of times they can cough it up on their own if they do it forcefully enough. If they do lose consciousness from the obstruction, then you will move on to chest compressions the same way that we talked about. Recap, CPR is easy. 3 C's, check, call, compress. There's no reason to not do CPR. You're protected legally, your health is protected, and you can save somebody's life, which is a huge deal.
We had 2 games that night. I was in a lot of pain, which I was used to because I'd been playing in pain the entire season.
You could tell that she was laboring somewhat, but Claire just has the heart of a champion, and she's just going to keep playing.
I was sitting at the scorer's table, keeping score for the game, and I just heard a loud thud.
I think we just started yelling for help.
Yeah, yelling 911. You have a feeling of helplessness.
And it was very quickly that there was people there with us, very quickly.
She fell about right here. Starting back in 2006, our school got the first AED. As part of that training, we would come together and we would have drills unannounced. Because of the code blue drills, there were some things that were just instinctual to me. The AED is literally right outside of those doors. Go grab the AED, bring it back, and get to work.
You really can't describe just the fear you had going through your mind.
It really looks like they were running a drill, that it was so quickly that people were to Claire and that they were taking care of her, and it was amazing.
She was in VFib, and so the only thing that would bring her heart back into a viable rhythm was to have a shock. The AED was needed in order to bring her back to life.
It was complete joy seeing her revived.
I'm just really thankful, and I feel really blessed that this is where I was chosen to go to school at, and just really thankful.
We know that God created her, and He knew about this moment before it happened, and He knew who would be here and what the outcome would be, and then what we would be responsible to do going forward to share her story. Well, we wouldn't let our child participate in a sport anywhere at this point if there wasn't an AED machine accessible. Waiting until someone's gone is not a good time.